In January of 2012, I was diagnosed with breast cancer, stage 1 on one side and DCIS on the other. So it was decided that I would have bilateral mastectomy followed by reconstruction.
First of all, with Susan, I met her when she was first diagnosed. And of course, at that time, we were talking about different surgery options. And then once she made her decision and had her surgery, that's when I kind of mentioned cancer rehab, especially post-op, because she was having some issues. And I knew the cancer rehab program would help her so much. I always make a follow-up phone call to see how the cancer rehab is going, and they rave about it. They say it's the best thing that ever happened.
Physical therapy has multiple roles in rehabilitating a patient after breast cancer surgery. There is what people think of kind of as the immediate physical aspect of doing the therapy, of physical therapy, which is scar mobilization, strength, range of motion improvement. There are techniques to improve lymphedema, prevent or treat lymphedema, and to minimize it if it becomes present. And then there's a later stage of rehab, which deals of physical therapy or rehabilitation, which deals with the second phase of care, which is to get a patient back to the level of care of physical functioning that they were at before the surgery.
So when Susan was diagnosed with breast cancer, she had a relatively advanced situation where there were issues with wound healing and the involvement of the breast to the point where surgery was really not feasible, and we had to start with treatment to try to shrink the cancer. In her case, I was able to devise a treatment strategy that used hormonal therapy, not chemotherapy, but pills that actually deprive the cancer of estrogen. And because estrogen was fueling her cancer, it was able to shrink up and actually completely disappear, so that by the time she had surgery, there was absolutely no cancer left. So the rehab program is really part of the holistic care of our patients. If we think that what happens in the clinic, the medicines we're giving or the surgeries we're doing, the radiation, is the entirety of a person's life, then we're missing the whole point. And that is, when we treat cancer, we're trying to help a person live. We're trying to help them live their life and live better. Physical therapy and rehab really is focusing on all the other aspects of life. Someone's ability to do their usual tasks, to feel comfortable, to relieve pain or shortness of breath, and to actually engage in life.
I like to travel, and so in August I was on a trip to Papua New Guinea, and we were snorkeling one day in the Bismarck Sea, and the sea got kind of rough, and I was swimming right along with everybody else, doing everything that we needed to do, seeing these beautiful fish, and all of a sudden it hit me, oh my gosh, 6 months ago I was having breast cancer surgery, and here I am in the ocean, able to do exactly what I want to do physically. And it was a wonderful feeling. I would absolutely recommend Aurora Advanced Rehabilitation Services. There's a highly trained therapist waiting to customize services especially for you. Why wouldn't you go?